Welcome to We're on ECMO, an educational series for the ECMO community. I've got a special guest today, Corey Collins. Thanks for joining me today, Corey.
Thank you. Thank you for having me.
The pathway to becoming an ECMO specialist can take on different forms for different people, but I get asked that question often. How do I become an ECMO specialist? And so, Corey, as an RT who recently became an ECMO specialist, I thought it would be great to sit down with you to hear a little bit about your journey so maybe other people can learn from that or compare their story. And so starting out, can you tell us a little bit about your history as a RT? How long have you done that? What kind of spaces have you done that in? And just kind of share a little bit about that.
Yeah. So I've been an RT for 3 years now. I graduated in 2021. From there, I went off to start at a small hospital, kind of rural desert in California. How those hospitals work is you never had a specific space. It was just you were everywhere. If you were in the ICU, you also had floors. If you were in ER, you also had floors and kind of, EKG outpatient stuff.
Mm-hmm.
And while I worked there, I always had a second job. And the second job was a big teaching hospital also out in the desert out in California. So I worked there for a little bit. And, from there, I stayed probably for a little over a year and then moved out here to Oklahoma. And then Oklahoma, I started at a big teaching hospital and it kind of opened the doors to a lot of different pathways. And I really enjoyed being there since then.
Mm-hmm.
And, I stayed there up until my current job now, where I'm at a children's hospital, big teaching children's hospital here in Oklahoma City.
Gotcha. Gotcha. How did you first become interested in ECMO? Is it just that experience being, kind of rounding out in those different places? You got kind of your eyes on it here and there. Like what drew you to ECMO?
What brought me to it was when I started as a respiratory therapist, COVID was prime peak happening everywhere. And you hear, as a new therapist, you hear ECMO being thrown out there, but me still trying to figure out my job, I never knew exactly what it was.
Mm-hmm.
And as my colleagues around me went to school to become ECMO specialists, they started talking to me more about it. More patients that were getting sicker got put on it, and it became more to light as far as a therapist as, this is the next step in therapy, what we need to look for patients getting towards. More things just came out and it became more popular and it got brought to us. And that's what really, brought, I guess, it to my attention in the beginning part is at the end of COVID when everyone was just talking about more and more and more.
Yeah. Yeah, I think that's a lot of people's experience, right? They just really learned about it, on the job, and especially in the last few years, kind of blown up, especially in the adult space. And so people started pursuing it, like yourself. And so, ECMO Advantage, we've been honored to be a part of your journey in a small way, but you came to a training and simulation course at our training facility in Murfreesboro, Tennessee. How did you hear about us? What drew you to looking to pursue that course on your own versus waiting for your hospital to train you?
So when I was working at one of the teaching hospitals in California, a good buddy of mine actually attended your course, and that was his next pathway in his career was to become an ECMO specialist. So he attended your guys' course, and as time went on, he would kind of set the standard for me as to what to learn, what to look for in that aspect, because I would lean on him for experience and advice. And he
Mm-hmm.
started talking about how great your guys' course was, the things he learned. He accepted a job also in Southern California as an ECMO specialist, and he would tell me the things that were advancing in medical kind of practice, how these really helped out patients. And he drew all that from his experience at your guys' facility. So
Mm-hmm.
it also brought me to you guys to look forward and, take my path into signing up for your course and see what it could do for me as a therapist.
Okay. Yeah, that's great. We always appreciate it when people, share their experience. That's one of the best ways we know to help people, get the word out is to hear how other people have experienced it. And one reason why, we definitely wanted to have you on. Um, since you've taken our class, um, you've gone on to accept this position as ECMO specialist. How did that course like play a role, in achieving that?
Being that you guys are very well known, especially out here in Oklahoma and Tennessee area, everyone knows who you guys are. So when applying around at different places, I kind of just put in there, hey, just ECMO certified, just trying to figure out, what the next step is. And at the hospital I was currently working at before I got the children's, I was speaking to a couple of physicians, and when they caught word of where I trained at, they knew who you guys were and they helped kind of put the word out. So when I applied and interviewed, they'd say, hey, where did you get certified? I'd say, hey, it was ECMO Advantage. I went there. It was a lot of experience, and just your name alone actually pulled a lot of weight in the fact that they're like, hey, this guy's willing to learn. He went to a school that's very trusted. They put out a lot of skilled specialists. And I think that's what really helped me get the job as where I'm at now, because your guys' trusted name and brand.
Yeah, I'm definitely biased, and I know that we've got some fantastic trainers and educators, and just the type of simulation and that our team is able to do and help people walk through, makes a big difference. We love to hear that kind of feedback. We know that there are others out there to do that, and they may be a part of other people's journey, but we really appreciate being able to do that for others. And people always ask us, well, how do I become an ECMO specialist? And we can't always say, well, just come to our course and it'll happen. But we know that there are lots of people who, when they really desire to pursue becoming an ECMO specialist, having that training under their belt goes a long way. And it's nice to know that our specific training, is able to help influence some of that. So how has your experience as an ECMO specialist now, how has that changed your clinical practice as an RT? How has that impacted that?
So it's definitely broadened my, I guess, job scope, and the fact of not only do we do the vent, but we're going to look at the pump. I've had to take to learning sort of the nursing side of it. So we'll run our CRT machines through the pump. So working with the nurses as far as their pumps, blood administration, medication administration, learning their side of it. It's really helped me kind of open my eyes to see what everything's about, not just paying attention to the respiratory side, but also, the nursing side of it. And it's actually helped quite a bit, and just feeling like more confident in what I do, and just to see more that's out there instead of looking at one specific area. So it's been quite an experience.
Yeah. Yeah, the teamwork aspect of ECMO, and the different kind of gifts and skills and knowledge that RTs and RNs bring, and the way that they're able to share together. Everybody, I think, is really able to grow in this space, and that's really neat to see. That's the same for perfusion as well, and even physicians, as they learn a lot from you guys as well. Well, thank you so much, Corey, for taking the time to join us. Any final thoughts that you would have to share?
Just that anyone who's looking for ECMO and to get into it, just do your best to put yourself around it, understand it, talk to everybody, just talk to the physicians and the nurses. They're very smart and they're very knowledgeable, and especially from an RT background, those aren't things you're normally taught. So that was the one thing that mainstreamed all this, was just picking everyone's brain and just moving forward day by day. And you may feel like it's almost like an imposter syndrome, but one day it just happens.
Awesome. Well, thank you. Thanks again. If you're out there and you're watching with us today and you have a question you would like to hear answered by somebody in the ECMO community, or somebody that is adjacent to ECMO, make sure that you send that question to me, Neil, Neil, at ECMOadvantage.com. We'll see you next time.